So we are recording so that we can share, and we've been intending to get stuff changed to YouTube. We haven't done that yet. I will probably share this one that'll link directly to our Zoom link so people can see it sooner. And get the latest on what's going on for new services with Mended Women, and also lend, of course, anything else that you want to provide too. So I'm Margaret Firerobin, and we began these coordinated community response meetings in March of 2020 within a week or so of COVID lockdown. We met weekly at that time, then we went to every other week. Now we do monthly. We try to coordinate with Bristol Coalitions that meets on the second Tuesday at 12. They're doing hybrid meetings. We continue to do Zoom only on the fourth Fridays at 11. We try to keep our meetings to about an hour. Sometimes we've gone to about 12:15 a few times, but amazingly, it frequently works out. We encourage you to share your contact information in the chat. I do try to send that out afterwards so that you've got the chat notes. If anybody sees somebody on here or wants to continue conversation, doesn't have contact information, don't hesitate to contact me, and chances are pretty good that I can get that contact information for you if you can't find it. And our next meetings are Bristol Coalition, September 12th at noon, and our meeting, Coordinated Community Response, is September 22nd at 11. Hopefully I got those correct. I want to thank Ellen Talton in particular for catching my mistakes. If y'all catch mistakes, don't hesitate to let me know. I could blame it on my age, but they're the kind of mistakes I've probably been making for the last 15 or 20 years. So just careless, not double checking things. So appreciate Ellen. Anytime. Good. Appreciate all y'all, appreciate the work that you're doing. We will share after Linda presents. She is coming from one meeting. She is getting ready to go to another meeting. So we're glad that we could catch her for a few minutes in between. I know if y'all are like me, we've heard about the Mended Women. We know a little bit about it. We knew it was coming, understand it to some extent, but now it's here. And so learning a little bit more about timelines and expectations would be fabulous. And we hope that Linda will not break down, because she's exhausted from breaking down too much, too often with everything that's going on that's touching people's hearts and spirits. So with that, and if y'all have questions, you can always put them in the chat. Also, hopefully there'll be time at the end to have a few questions for folks. So Linda, with that, and Linda, you can also, your Hands and Feet Ministry, and also Appalachian Substance Abuse Disorder Coalition. I forget the name of that one.
We just call it ASAC.
Yes.
It's much easier. It's the Appalachian Substance Abuse Coalition for Prevention, Treatment, and Recovery. It has a really long name. So ASAC is a regional umbrella coalition that covers the 13 counties and 3 cities of far southwestern Virginia. So we're about 18 years old now, and we educate, advocate, connect folks to each other and to the resources they need, but also resources one to another, because it's important that we know what's going on in each other's agencies and ministries. So we can plug our folks into the other resources that exist in our communities. So Hands and Feet is a jail and prison ministry based in Damascus. We do a lot of work inside correctional facilities, and we also help folks as they come out of incarceration. So through both of those nonprofits, I have been painfully aware for a long time about the need in our community for treatment and housing. As we all know, both of those have been problems for a long time here with the substance misuse that we see all around us. So back in December 2021, we decided to have a Zoom meeting. Ann Ledgerwood, who is the founder and director of Samaritan House Ministry, which assists women coming out of incarceration. Ann and I often had those conversations that we all have. But Ann and I see it from a little different perspective because we get calls often because of the ministries that we do from correctional facilities, needing to place women. And so we often felt helpless because there was nowhere to send folks. And so through my work with the incarcerated and reentering, Fairview Housing, when they started to open Bristol Lifestyle Recovery a few years ago, contacted me. And so we've been working together ever since. Bob Garrett is the CEO of Fairview. Fairview was actually started about 50 years ago in Tazewell County, Virginia, to develop affordable housing. And so Bob was part of that. He has developed all of his life. And so we started working on Bristol Lifestyle Recovery, which just celebrated its 3rd anniversary. Of course, that facility is a treatment facility for men, and we had nothing still for women. So on December 29th, 2021, we had our Zoom meeting. There were 4 of us, and and Bob Garrett was one of them. I intentionally asked him to come to the table because I knew he had the expertise that we needed. And so he was gracious enough to do that. He told the Attorney General when he was here at the facility. I am in one of the rooms at Mended Women, if you guys didn't hear me say that earlier. But Bob told the Attorney General when he was here with us that he didn't think anything would come of our efforts, but he came to the meeting because I asked him. I tend to harass people if they need to be somewhere that they are hesitant to come to. So we needed him. And so he came. And so we decided to meet back in 2 weeks because of the holidays. And in that length of time, we found this building I'm sitting in today. For those of you who are not aware, we started moving women in last Monday, the 14th. So there are 6 women living here now. I will give you the number when we conclude this conversation about how folks can make contact with the facility and submit that application. But the need existed because the needs assessment that Johnston Memorial did that was published in June 2021, the top 3 health-related issues affecting our overall community, according to that report: substance abuse, number 1, mental health, and number 3 was access to care, or the lack of, as we know. So that changed. The lack of care here in our region, that changed last Monday when this facility opened. It is designed to meet the needs specifically of adult women who have been detoxed, who have a history of SUD. Okay, this is the only facility of its kind within 150 miles of Abingdon. Our folks were having to go into other states or to the other end of our Commonwealth, which didn't need to happen. We need to take care of our own. So there was a gaping hole in the recovery ecosystem here in Far Southwest, and this facility has plugged that. So all of those needs are being met at Mended Women. We have 5 regional jails here. At any given time, they house right around 500 women along with the men. And more than 70% of the incarcerated in our region are there on drug or drug-related charges. So to release them without treatment being available, it's just like spitting in the wind, So it's just beating our heads against the wall. So now, many of the women living here have come out of incarceration. They didn't go back to where they came from. They didn't go back to the abusive relationships. They didn't go back to couch surfing in a house where there was substance being misused. So DBHDS did approve this facility for 70 beds. So it is licensed for 70. The administrator told me last night that he doesn't know that we'll ever actually put 70 women in here because some of the rooms are a little tight. And we want women to be comfortable. We don't want them to be, to be stuffed into a room where it's not therapeutic for them. So we may not get to 70, but it is licensed for 70. He expects it's probably going to be somewhere between 60 to 65 women living here at capacity, which is going to likely be close to the end of the year, maybe the beginning of 2024 before we meet that. They are doing a very slow roll to make sure the staffing is in place, the women are comfortable, and the needs are being met. So this is an ASAM level 3.1 low intensity and clinically managed residential treatment program. Okay. The facility is in Abingdon. It's on 6.5 beautiful acres of property right in the middle of town. BLR, which is Bristol Lifestyle Recovery, Fairview at BLR, which is exactly like this program, has about an 80% success rate, which is extremely high in this field. So, of course, Mended Women is a project of Fairview Housing. They hold the license and they are providing the care here, the treatment. MAT is possible here. That's something a lot of people ask. We do have doctors that come on site. All the medication here, even over the counter, is dispensed by medical staff. We have nurses here. So this facility exists because of grassroots effort. We all need to understand the power that we have when we come together to make something happen. It didn't take, Richmond coming down here. Richmond actually thought we had treatment facilities down here. When I told the Attorney General August 2 years ago that we didn't have a treatment facility, actually it was last August, his mouth literally dropped open. I mean, they don't know what's here and what's not. So I tell people all the time, when you get Richmond's ear, tell them what we need. Tell them we're down here. I heard a term yesterday. I spoke at the DMAS conference and did a mass Narcan training, which was great. We trained 73 service providers and then 3 staff members there at the higher ed. But have you all ever heard the term ROVA instead of NOVA? ROVA? That stands for the rest of Virginia. That's what they call us down here. ROVA. So we officially live in ROVA. Good to know. So on June the 4th last year, all we had was a vision and a lot of passion for what we were doing and a lot of people willing to do the work, but we had no money. We had no money on June the 4th, 2022. On the 5th, we got our first donation of $10,000. And when the Opioid Abatement Authority granted us the first money that they dispensed in the Commonwealth of Virginia, we were notified on April the 11th that was coming. That pushed us over the $718,000 that we needed to open. So in less than a year, that money came in, and we now have gotten a second grant from the OAA. And so we are at $1.5 million. And this property, Fairview will buy this property in this building to be used for many years to come for the healing of our communities. So applications are being accepted. Okay. You can go on mendedwomen.org, or you can call 276-451-3996 and ask to speak to admissions. Now, do any of you all have questions?
So Linda, can you describe your staff?
You know, pretty amazing. Fairview, as they encountered people, as people applied for Bristol Lifestyle Recovery long before Mended Women opened. As people applied to BLR, they went ahead and hired them, trained them, put them to work at BLR. And so the day that Mended Women opened, they transferred 24 staff members here.
24?
Yes.
Oh my gosh.
Yes. So this facility is fully staffed. There are doctors on call. There are nurses here. And then we have a lot of mental health professionals, a lot of care coordinators. We actually have a volunteer training on the 31st. This community has absolutely embraced this facility. It's just been amazing. I mean, before we even, we have been so hyper focused on getting the facility open that we haven't thought about Christmas coming very quickly. And we actually had a church that reached out to us and said, we want to provide Christmas for your residents. I mean, it's been amazing to watch, honestly. So many folks in recovery have come here to work and to paint and to clean. And they are just so excited that people coming behind them will have a place. One of the young ladies with Washington County Recovery Court that was here painting and cleaning, I was at her graduation the other day, and I told her, she told me the day she was here, if I had had this facility when I was trying to get in recovery court, I could have gotten in 6 months sooner because I was homeless, right? Didn't have anywhere to go. You have to have an address. And so, she was just very emotional. She said, if I had had this, life would have started over much sooner for me. And at her graduation, I said, Betty, because you were there helping us get this building open. On the 14th of August, the women coming behind you are going to have a place to be. And you had a part in making that happen. Folks in recovery need to realize the power that they have through their lived experience. We all need to realize that power that we have as just common, ordinary people to make a difference in people's lives. Coming together, I mean, it's amazing what has happened here. So our first meeting was December 29th, 2021. August 14th, 2023, this place opened. Our first woman moved in August 14th. Pretty amazing.
More than amazing. So somebody asked do y'all take people who don't have any insurance? How does that work? Do you help them get insurance? How does that?
Yes, this is a Medicaid funded facility. Okay, so the treatment here is built to Medicaid since we are licensed. So if people have Medicaid, Virginia Medicaid, or if they are eligible and just haven't applied, that covers them being here.
So y'all will help them do application to Medicaid. So people who are referring, if they haven't had the time or had the client long enough to do that, y'all would go ahead and help to get that done.
That's right.
Right. And if they've had Medicaid in Tennessee, but not Virginia, you could help with that.
Well, they have to, from what I understand, they have to have a Virginia address. and at least spent one night in Virginia. They have to have Virginia Medicaid. Tennessee hasn't expanded.
So what happens to people who have been living in Tennessee and who have Tennessee Medicaid? Can they change? How do they do that? And I know that some of this is really hard, and from Family Promise, where the shelters are in Tennessee.
Right.
So can you talk just a little bit about how that, and that for us, for rapid rehousing, monies from Tennessee, they have to have spent at least one night in Tennessee. So we understand some of that, but how does that work for getting people changed from Tennessee to Virginia?
Well, of course, unfortunately, we don't have a shelter here in Washington County, Virginia. So they have to have spend a night here and have to have a Virginia address to apply for Virginia Medicaid.
So that's one of those bureaucratic things that's pretty difficult.
Yes, it is
here on the border.
Right.
So, and as far as I know, Southwest Virginia doesn't have, the shelters are Kingsport and Bristol. Southwest Virginia, both of those are Tennessee shelters. So
there are like the Hadassah House in Smith County and Adkins. It is a facility for women. So if you're working with someone and they need to be in Virginia in order to get treatment, the Hadassah House may be an option for them. And if you can't find it online, I have contact information. But you know, they have to have Virginia Medicaid. It is possible to do self-pay, but most of the time people can't afford it because it is, you know, any treatment facility is not within most people's budget, unfortunately.
So how do, and other people can jump in too, but so if there's somebody who is in Tennessee homeless at one of our shelters who has Tennessee Medicaid, we can get them to stay a night in Virginia and have a Virginia address. We can figure that out. Does the referring agency need to get the Virginia Medicaid, or with that scenario, y'all could pick it up and do that?
Right. We have folks here, or they have folks. I say we. I think I'm part of everything. I'm not really on staff here.
Right.
I just claim this program, and fortunately, they claim me as well. So, but there are staff members here that can walk them through the Medicaid application.
Okay, so as long as they can do the one night and have some kind of address, then y'all can figure out or take it from them.
Right. Okay. They can apply for Medicaid, and then once that is done, of course, they have to choose a carrier. I think there are 6 carriers that work with folks here, and the carrier makes the decision. Some of them do it, 30 days at a time, 2 weeks at a time. There is one of them that, because of Fairview's record at BLR, they actually approve 90 days as soon as they come into the facility. So it depends on the carrier. That varies greatly.
Okay, so people are putting some questions. Is there a maximum term of stay for residents? Do y'all have a limit, or that's dependent on Medicaid, or?
That depends on the carrier. I know 60 to 90 days is pretty typical, but there is a man that has been at Bristol Lifestyle Recovery for more than 6 months, and his carrier has continued to approve him to be there. So it's on a needs basis.
Okay, and with advocates, because we know that really the baseline is at least 90 days.
Yes.
For brain changes, etc. So although hopefully they've perhaps detoxed in prison or jail to some extent. So okay. So, and you talked a little bit about the drug court. You have judges and court folks that are supportive of both their programs as well as yours.
Yes, absolutely.
Okay. And different judges that are cheerleaders and such.
Yeah.
Great.
Yes.
I think maybe, and other people could correct me, but I feel like Virginia's maybe done a little bit. Our area in Virginia has been a little stronger with drug courts earlier than what Tennessee has done. But just that's an impression. Spiro Health has been coming to the Place to Be day services, and they also might be helpful with our folks as well as anybody else on here from Tennessee. Somebody's asking about Unite Us. Are y'all using it, or is it possible to use it, or make referrals through it, or how does Unite Us come into your work?
You know, that I don't know if they are, I can check on that. I don't know if they are using Unite Us or not, but I will find that out.
The challenge for lots of folks is a lot of agencies are already using a couple different databases, and trying to add another makes it a challenge. So I know that's still being tried to look at and try to figure out how to make it easier, but for that sharing platform across our region. Yeah. And do y'all have grants where you use HMIS? You don't know?
Not for this facility yet. That may be something down the way. I know Fairview uses HMIS at Manor House. Right. They have a lot of HUD grants there.
Right.
But yeah, this is probably, they're probably not going to do that here since it's treatments. Right. Yeah.
All right, other folks, I've kind of dominated. Who else has questions they haven't put in the chat? I can't see hands, so well, I could if I change this. Anybody else have any questions? Do you want to repeat that the phone number again, Linda?
Sure. It's 276-451-3996. And we do plan to have a community celebration. If you've not been to the facility, excuse me, the women, the residents are living on the top floor, the first floor. There's also a second floor that mirrors the first. And so there are no residents on the second floor, and there's an entrance on the second floor. So we do plan to have a community celebration and invite folks to come in to the second floor, so we're not disturbing the residents. Of course, the residents will be invited to attend if they want to come down, but we just don't want to disturb their living area. So I will let Margaret know when that is scheduled. We're trying to do it through the chamber, and the Washington County Chamber is so full of events. It would be October the 24th or 26th if we waited and did it on one of their Tuesday or Thursday. So we may just do it on another evening after work, probably like 4 to 6, and give folks a chance to come in that haven't, because before long, women will fill these rooms that I'm in right now as well. So before that happens, we want to invite folks in one last time so you can come and see and also feel what it's like to be here. It's pretty amazing. Margaret, I do want to make a comment. You know, yesterday I spoke at the DMAS conference here in Abingdon, and one of the things I shared with them, the pioneers that we have in our region. The first drug court in the Commonwealth of Virginia was started here in our region in Tazewell County. The first in the whole Commonwealth. The first comprehensive harm reduction program in the Commonwealth of Virginia was started here in our region in Wise County by Dr. Sue Cantrell, right? Dennis Lee started the recovery court program in Tazewell. Of course, Dr. Hughes Melton, that went on to be the commissioner of Virginia's behavioral health. He is one of the founding members of ASAC, as was, you know, Sue Cantrell was there in the beginning as well. So, you know, coming together to solve problems is what we do here in Far Southwest. It's been going on for many years. And so taking care of people and loving on people. The problem has become a bit overwhelming, but there are still so many folks doing good and fighting the good fight. So I'm so thankful to be part of your circle and to be part of the good work that you're all doing.
Thank you, Linda. Yeah, and I know Dr. Art Van Zee in Pennington Gap, who also they attempted a recovery center many, many years ago that did a while. Early on, plus he was one of the first whistleblowers for
yes.
Purdue Pharma.
Dr. Van Zee is one of the founding members of ASAC as well. He's still in his little clinic in St. Charles. I expect somebody will go in one morning and he'll be there. His spirit will be elsewhere, but Dr. Van Zee's body will still be there. He's not leaving that clinic anytime soon.
I would agree with you, Linda. So the other observation, and whether you have any comments or whatever, is we have seen in our region the response to this is phenomenal, as we've seen in the newspaper, as well as you're talking about it. Also with Isaiah House, the response has been just phenomenal. What can we do to help that kind of response for our male population that needs care just as much, and who many of them are daddies who are not able to be with their families for all the different reasons, et cetera. So for helping people to get excited about that population as well. Do you have any thoughts, Linda, or observations? Sure. Do we start here and then try to move mountains?
It is so important for those men to tell their stories and to become vulnerable to people. I mean, just the heartfelt stories. That's something that ASAC, we always try to have a recovery testimony at our meetings, give folks that platform. But I mean, people like Zach Holt, Zach is a father. His daughter struggled through his addiction with him. And look at Zach's life and what is happening now through his life and his lived experience. He is an amazing speaker. And to give him a platform, anytime you have a gathering, I mean, whether it's your Rotary Club or your church or, your coalition meetings, give folks the platform. And the men, I mean, I know people tend to be more concerned about women, but there are a lot of single dads, like you were saying, Margaret, in our area, raising children. Until OxyContin hit the market, it was unusual for a woman to be arrested. I mean, in the correctional facilities, there were not a lot of females because women were staying home. They were taking care of their kids while the children's fathers were out making bad decisions. But OxyContin changed all that. And, we see for a period of time there was just an explosion of females arrested, and that's never really gone away. The correctional facilities are just full of women, but the men have the same story to tell. Many of them are struggling to take care of their kids. I know there is a man in Bristol. He's raising his 3 children because his wife overdosed and died last year, and like you say, I mean, I connected him to a church to do Christmas for them last year because his wife passed away not long before Christmas, unfortunately. But there are those champion fathers out there too that are in recovery that need to be telling their stories, and a lot of that will help dispel some of the myths about deadbeat dads that we so often hear. Because some of the men are doing really amazing things as well, and their stories need to be told. And I want to mention to you all, Mountain Mission School in Buchanan County, if you're not aware, if you are working with folks who are struggling and they have custody of their children, they can place their children at Mountain Mission for days or weeks or months or years. And Mountain Mission will take care of them. They live on campus. It is a fully accredited school. Any children that do the 4 years of high school at Mount Mission, they can go to any college they want and get a bachelor's degree, and it's fully paid for by private donor. So that is a wonderful resource in our community. I personally know people who are hesitant to try to get into recovery because they don't want to lose their kids. They're concerned about not getting their kids back if they put them into the foster system, or what might happen to them in the system. And so them knowing that Mount Mission is there, and they have full access to their kids, they can pick them up anytime, they can visit them, have weekends with them. And they never lose custody of their kids.
Thank you for that. And they'll take kids from any state?
Yes, they will.
It's not limited to Virginia. Great.
No, and it does not cost the families anything. It is privately funded.
Okay.
By the coal dug out of those hills.
Yeah. Yeah. Thank you, Linda.
Thank you.
Anybody else? So, Linda, we want to thank you greatly for everything you do and being one of those pioneers and heroes in our region with the work that you do. And I see Tony clapping for you. And really appreciate the time you take to be here with us all the time, but especially today. It looks like Christine is clapping as well. So anyway, so thank you so very much. And we know you need to run quickly, so don't hesitate to pop off. And we hope to see you soon, one place or another. So
yes,
that's all.
Thank you all.
How we can help. All right.
Thank you all.
All right. Thanks.
Bye.
Bye. All right. So now we've got a few minutes to be able to share, and we've got some folks on that are newer, as well as some of our folks that have been here for a good while. So if we can go ahead and start, and I'll start with my less familiar faces this time. So I'm looking at Renee Crick. Renee, would you like to talk for a minute?
So the only new update that I have really to report is that Bristol CNY is going to be adding another licensed provider to our team in September. That'll be Noelle Grimes. And so she's going to be coming back to be a licensed provider. So that will give us 3 licensed providers that are eligible to accept private insurance clients in children and youth.
Okay. Great. And did you put your contact information in the chat somewhere?
I will do it right now.
That would be awesome. Thank you very much. Okay. Tori Dreyer.
Hi, Tori Dreyer with the Department of Veteran Affairs. I am with the James H. Cullen VA Medical Center there in Johnson City, Tennessee. I am the CEPC. What that stands for is the Community Engagements Partnerships Coordinator. I am part of the suicide prevention team at the Johnson City VA. So my interest, I believe Jamie Kincaid was gracious enough to invite me to this meeting, so I appreciate being here. Is building coalitions, helping to build coalitions in communities, especially Southwest Virginia, that's focused on reducing veteran suicide and suicide in general. We also offer training such as VA Save, which teaches people how to have conversations around suicide, and, getting people connected and, looking at mental health, but we also do lethal means safety trainings. So just interested in collaborating or having discussions with anybody here that might want to have a focus on that. I am more than willing to have a conversation. So thank you for having me.
You're muted, Margaret.
Jamie Kincaid, do you want to follow up and add to that?
No real updates from me. As many of you all probably know, I was out for quite some time with just health related issues. I work out of the Abington office with the Department of Veteran Services. We are a state agency. I'm not affiliated with the VA at all, but we assist veterans with mental health needs. We can link those veterans and their families to mental health treatment in the community and pay for those services if they need it. I can help with everything from housing, food assistance, utility assistance. We have recreational events and that sort of thing. I do work with a lot of the community partners, so I'm in contact with the United Way, work with tours,
Hey,
volunteers.
Kwame, John's out there at the hospital.
I'm sorry.
I'm muting, while trying to.
But other than that, I put my contact information in the chat box. So if anybody's working with any veterans or veteran families, just send them my way.
That sounds great. Thank you, and glad you're back.
All right, thank you.
Tony DeLucia, you're working with VA programs with a grant. You want to talk for a minute?
Well, of course, I put a bunch of things in the chat because recently it's gotten so darn exciting that I think my grant from the Appalachian Regional Commission, Sparking Resilience, the Veteran Substance Use Disorder Support Alliance in Northeast Tennessee, which was just to put on a conference to check our political will to do the right thing. We followed up with the funding that we had left with putting our best foot forward, which was, I've been putting things in the chat, like the people that were there. It was very successful. And now it's trying to enlist people who really want to help shape the kinds of funding requests that we send to Appalachian Regional Commission, with like March is the deadline and letters of intent at any time. And so the amount of money is not huge, but when you look at what Linda's doing, it's like any amount that could be provided would help us build what I'm calling a social enterprise. And we just had our convocation for the ETSU faculty, and it seems like that's really catching on, that the connection with community is first and foremost what we're all about. And so I'd love to work with anyone. Our conference was at the Bristol Hotel, so we're thinking already about multi-state, and the big money from Appalachian Regional Commission is called their Arise grants, up to 5 years, $10 million. And I'm thinking really that we need to focus on resilience, perhaps more than a specific target group like those with substance use disorder or veterans, but all of us. I mean, all of us could use resilience. That came up several times today in President Nolan's comments, and it seems like, why not?
Great. Thank you, Tony, very much. And thanks for your enthusiasm and passion and history with our region, being a pioneer in many different areas. Lindsay McNabb.
Hello, can you hear me?
Yes.
Hey, I just used to live in the Tri-Cities, but I work with John at Creekside, so I had the time a little wrong today, so I apologize. But we're building the 24 new rooms. They're going to be completed soon, so we'll have 96 beds at our facility. We help kids 9 to 13, 14 to high school diploma. We help adults with mental health issues, and we do a lot of work helping people with substance abuse that need to be stabilized. We do take Medicare, and the 2 years I've been here, I've been trying to advocate for transportation, and we now have 2 vans that have Creekside stickers or whatever that you put on the side, but we do have some transportation if that's an issue. So we're really excited about that.
Great. Fantastic.
Yeah.
So, thank you.
Thank you.
Anthony Hernandez.
Yes, I'm with
Antonio, sorry.
no worries, you're fine. I'm with the Virginia Department of Health. I'm a community health worker, and we don't really have anything too new to update. Aside from we've been noticing a lot of organizations don't know, we are doing in-person WIC and baby care and stuff like that now. So that's something we're trying to get out there. And we also do have we do vital records for Virginia. So if you need a birth certificate, death certificate, divorce, or marriage license, you can get that with us instead of the DMV. You can avoid those long lines. And I'm not supposed to say this, but it is cheaper than DMV. So if you need any of that, come to the health departments.
Awesome. I know some people that are probably going to check that out and see how that goes. So, great. So, and the DMVs are outside of our public transportation area. So that's good. Very good to know. So, appreciate that very much. All right. Cities, Christina, well, first off, yeah, let's do the cities, and then Caroline Hawkins will get you next. So,
hey guys, good morning. I'm Christina Blevins, Community Development Specialist for the City of Bristol, Tennessee. I do have a quick update. I presented to this group a couple months ago about our home ARP funding, which was federal home American Recovery Plan money. And basically the allocation plan is $3 million for the development of affordable housing, $211,000 for supportive services, and a little over $200,000 for nonprofit capacity building. We have this summer come up with our 40-page RFP for folks to get this funding. You do have to be a community housing development organization, also known as a CHODO, or a public housing authority to actually apply for the money. But what we're hoping is that those organizations will partner with groups such as yours for the nonprofit capacity building and the supportive services. So we just wanted to promote partnerships, and honestly, this seemed to be the best way to do that. So the RFPs will go out next week, next Tuesday, the 29th. We will have a conference on September the 14th at 10 a.m. here at the Bristol, Tennessee City Annex building. All questions will be answered by September 28th. The RFPs will be due back to me by October the 18th. And then we anticipate an award announcement on November 14th. And groups will have 2 or 3 years, I think, to get the building of the affordable rental units completed, and then those partnerships would start kicking in. So it is a 15-year compliance period. So it's a pretty long project, but we think we've done what we could do with this grant funding. So happy to answer any questions.
If anybody has any questions, also, Christina, we want to thank you and all your team. So is that, Brittany, are you asking a question or are you clapping?
I was clapping. This is great. It's exciting.
Yeah, and we want to thank you. This is a pretty ambitious schedule, and there's a lot that goes on in between, and having to do all that is huge. So appreciate hugely everybody who's working on this, and it is a really nice opportunity for our community. So
thank you. It's certainly been a process and a very busy summer. So,
and I should say it's our region, our regional community, because it's Johnson City, Washington County, Tennessee, Sullivan County, Kingsport, Bristol, and Bristol, Virginia. So appreciate that. So Ellen Tolton.
I really don't have anything new, Margaret, but I'll add my thanks to Christina and First Tennessee Development District for so quickly pulling all this together. It's been huge, and they've done a wonderful job.
So, and Ellen is with Bristol, Virginia. Christine is with Bristol, Tennessee. Both of them work in community development with the block grants, et cetera. We appreciate their partnership with each other and how they work to coordinate things across our state line, and we appreciate that greatly. So Caroline Hawkins and Brooke Jenkins from Crossroads Medical, do y'all want to share?
Hey, yeah. So a couple of updates. One of our nurse practitioners that had to step back for a little while, she is coming back to more of her regular time here for a while. So we're excited about that. So we're continuing to take new patients, and we are also one step closer on getting our health and wellness center. We're planning to close on that building here in the next couple of weeks, so that we're very excited about that. And Brooke and I, we're both community health workers, and we are celebrating Community Health Worker Week next week. So another exciting thing. But I think that's all I've got.
Thank you very much. And Brooke, do you want to add anything? And there you go.
No, I think that Caroline covered everything.
All right. Thank you and welcome. So congratulations for Community Health Worker Week. We are so pleased in our region with community health navigators, with strong starts, strong futures, all the different things that are helping provide support for people who are vulnerable and struggling in their lives to get their feet on the ground and be able to live a full life. So we really appreciate that work that's being done in those opportunities. So Kay Ward, would you like to talk about Bristol, Tennessee City Schools a minute?
I would, just for a quick minute. We do have some great academic news to report. Our spring TCAP test results outperformed students across the state in most state growth as well as achievement measures. And most recently, yesterday, Dr. Tudor announced that the district had achieved a level 5 composite score on the Tennessee Value Added Assessment data, which is the highest distinction available from the Tennessee Department of Education. TVAS data measures growth. We have assessments that are going to measure achievement and those that measure growth. And we were very excited with the distinction of a level 5 yesterday. Along that same line, our Reading Buddies program is getting ready to kick off for another year, and we're still in need of community volunteers. It's not a big commitment at all. It is 30 minutes, one time a week with one child. And I would be the person to contact if you're interested in becoming a Reading Buddy. All 5 of our elementary schools now participate in the Reading Buddies program. So these are kindergarten through 2nd grade students. The goal of this program is for our boys and girls to read on grade level by 3rd grade. No previous experience in teaching reading is required. We will help you and provide all the materials that you need. I also need to make this group aware that SantaPal applications have gone out in Bristol, Tennessee, Bristol, Virginia, and the eastern portion of Sullivan County. In our school district, those applications are available through our school counselors, and they are due October 3rd. And all these applications have to be submitted to the SantaPal board via U.S. mail. So we are off and running for another year in the school district, and we're very excited with our academic success within the past year and looking forward to another great year.
Thank you, Kay, very much. Brittany Fleener, Branch House.
Hi, everyone. I am the Coordinated Community Response Specialist for Branch House Family Justice Center. We provide free services to victims of domestic violence, sexual assault, human trafficking, and stalking. Just a really exciting update. As of late, we are partnered with Ballad Health now. Branch House same nurses are the primary providers of sexual assault exams in both Sullivan and Washington counties now. We have an on-site clinic at Johnson City Medical Center that our nurses respond to. So we also have an in-house exam room here at Branch House. We are also working with Ballad to open a clinic inside of Holston Valley Medical Center, and soon to hopefully open one inside of Bristol Regional Medical Center. So that now when someone is assaulted, they do not have to go to the emergency department, which is not where an assault victim belongs. They can bypass that step and go straight to that exam room in a more trauma-informed environment, and be met with an advocate and a sane nurse, and have those exams done in a more victim-centered and timely manner. So we're just really excited about that. We now have 9 sexual assault nurse examiners who are on a 24/7 rotating call for us. So we respond nights, weekends, holidays, it doesn't matter. And folks can call the Branch House 24/7 hotline and be connected with a coordinator to get those exams. Or they can report to the ED and they'll respond there too.
Great. Fantastic. Sounds good. So Family Promise. So we have Karen George, and we have Larissa Copley, and we have new AmeriCorps worker Faith Hamblin. So if y'all want to give a little update, that would be great, and that'll round us out.
Sure. The biggest update we have is we have brought Faith on as our new intake coordinator. So I know some of our partners have struggled to be able to get through to us sometimes, but our phone will now be answered 5 days a week from 9 to 4. And then Larissa, if there's anything else you would like to add, feel free.
I don't really have anything to add. With the introduction of Faith, though, that does mean I will be transitioning my role very soon into housing case management, which also will help improve our efficiency with getting people their assistance faster. I'm sure everyone on the call is aware of how difficult it can be to be burning the candle on both ends. But we're doing the best that we can to build our capacity and to help members of our community as quick as possible.
Thank you, Larissa. Larissa, before you go, do you want, or Karen, talk just briefly about what some of the Salvation Army, a place to be guests are going to be doing tomorrow morning or afternoon, whatever time?
Sure. So some of the guests that visit our place to be day services are going to be doing some downtown cleanup between, I think they're starting at 10 tomorrow. And they're going from Gold Star to First Baptist. So look out for some of our guests helping to clean up the downtown area tomorrow. We're excited about that.
And that was initiated by the guests, my understanding. So
it was.
That's fabulous. We are excited to support that. Okay, and thanks for sharing the information about our hopes to do better on getting to phone calls, et cetera, that have important referrals. But if for the many of you on this call know what it's like for us, the day services from 9 to 3:30 on Tuesday, Wednesday, Thursday are impossible to do anything other than work with clients there at the day services. And that's all of our staff, the case management staff. It's all hands on deck. So that slowed us down a little bit on our on being able to get to all our calls. Okay, does anybody else have anything else they wanted to add in? Any burning question or comment or anything? Faith, nice to have you.
Go ahead and look, Margaret. I put a comment.
A moderated listserv for the bi-states for addiction work. Good question, Tony. We'll have to put that out there and see if anybody, I'd say that would be more, I don't know. So Linda might be able to answer that question better than anybody else. So also parallel to Linda in for Sullivan County, it's Sullivan County Anti-Drug Coalition. Washington County, Virginia has, and I'm not going to remember it right offhand, it's Jennifer Bervin, and it doesn't have Anti-Drug Coalition in their name. I'm forgetting what their name is. Anyway, but we have similar work going on in Tennessee as well as in Virginia.
Insight Alliance.
Thank you.
Alliance.
Inside
Washington
Alliance.
County.
Thank you very much. Inside Alliance. So anyway, all right. With that, we're 2 or 3 minutes after. Nope, we're actually right on the dot. My wall clock is a couple minutes ahead. That's always a good thing. So we appreciate you all. Thanks for being here. I hope that Linda Austin's information was helpful, plus always inspiring. So we'll see you again in a month on September 22nd. If y'all have suggestions, I get ideas when we talk about different programs. We used to just network. We have done where the majority of the time now we do have a program that lasts 20 to 30 minutes. And most of the time still have time to fit our networking in. So if y'all have requests or suggestions, don't hesitate to send them. So thank you very much. So take care.